Sleeping on your stomach may seem harmless or even comfortable to some, but for individuals over 60, it can quietly cause serious damage over time. This position forces your body into an unnatural alignment, which can affect the spine, internal organs, and even your breathing. As the body ages, it becomes less resilient to stress and strain, and the cumulative impact of poor sleep posture becomes more pronounced. One of the biggest concerns with stomach sleeping is the stress it places on the spine. When you lie face down, your spine is often forced into an arched or twisted position. Unlike other sleep positions, it doesn't allow for a neutral alignment of the head, neck, and spine. For someone over 60, who may already be experiencing degenerative changes in the discs and joints, this posture can intensify back pain, stiffness, and even contribute to conditions like spinal stenosis or herniated discs. Neck strain is another major issue. Sleeping on your stomach requires your head to be turned to one side for extended periods. This can lead to chronic neck pain and reduced range of motion. In some cases, it may also result in pinched nerves, which can cause numbness or tingling sensations in the arms and hands, symptoms commonly mistaken for other medical issues. Beyond musculoskeletal effects, stomach sleeping also negatively affects your internal organs. This position compresses the chest and abdominal areas, putting pressure on organs such as the lungs, liver, and intestines. For seniors, whose respiratory and digestive systems may already be more sensitive, this compression can interfere with healthy lung expansion and smooth digestion. Individuals with acid reflux or GERD are particularly at risk, as lying face down increases the likelihood of stomach acid traveling back into the esophagus during the night. Breathing is also compromised in this position. The chest cannot fully expand, which limits oxygen intake and reduces the overall quality of sleep. Poor oxygenation during sleep can exacerbate heart problems, increase fatigue during the day, and impair mental clarity, all serious concerns for older adults trying to maintain independence and cognitive health. In the long run, regularly sleeping on your stomach can contribute to chronic discomfort, disrupted sleep patterns, and worsening health issues that might have been preventable. Health experts generally recommend switching to sleeping on the back or side, ideally with proper pillow support to maintain spinal alignment. For those who find it difficult to change sleeping positions, using a body pillow can help retrain the body to sleep in a healthier posture. Gradually, as people age, the body becomes more sensitive to poor posture even while sleeping. One commonly overlooked but dangerous habit after 60 is the use of too many pillows. While it may seem comforting or luxurious to sleep with several pillows stacked beneath the head or body, this habit can silently damage neck alignment, restrict airways, and contribute to serious health issues such as poor sleep quality, headaches, and even breathing problems like sleep apnea. The main problem with using multiple pillows is that it raises the head too high, bending the neck at an unnatural angle. When the head is propped forward, the cervical spine, the portion of the spine that runs through the neck, loses its natural curve. Over time, this awkward positioning can lead to chronic neck stiffness, soreness, and joint misalignment. For people over 60, who may already deal with conditions like arthritis or reduced flexibility in the spine, this added strain can significantly worsen mobility and pain. In addition to spinal issues, an elevated head position caused by too many pillows can obstruct the upper airways. When the airway is not in an open, neutral position, breathing becomes shallower and less effective. This is particularly dangerous for seniors with respiratory conditions such as chronic bronchitis, asthma, or sleep apnea. Improper head elevation may increase snoring, cause nighttime awakenings due to shortness of breath, and contribute to daytime fatigue due to lack of oxygen-rich sleep. Another problem often associated with excessive pillow use is poor blood circulation. When the neck or shoulders are elevated at extreme angles, blood flow to and from the brain can be compromised, especially in people who already suffer from vascular conditions. This can lead to morning headaches, dizziness upon waking, and even contribute to memory fog or confusion over time. Using too many pillows can also cause muscle imbalance in the shoulders and upper back. This happens because the shoulders remain in a hunched or tense position all night, preventing the muscles from fully relaxing. Prolonged periods of tension can result in tightness, spasms, or even frozen shoulder syndrome, a painful condition that becomes more common with age. So, what's the right approach for seniors looking to sleep comfortably and safely? Experts recommend using a single, firm pillow that supports the natural curvature of the neck without elevating the head too high. For side sleepers, a pillow with enough thickness to keep the head aligned with the spine is ideal. For back sleepers, a thinner pillow or a cervical support pillow helps maintain a neutral position. Memory foam or orthopedic pillows can also offer customized support without encouraging over-elevation. As we age, our bodies naturally undergo changes that make us more vulnerable to discomfort, stiffness, and chronic pain, particularly in the joints and back. One of the most overlooked contributors to this discomfort is the condition of the mattress we sleep on. After 60, continuing to sleep on an old or unsupportive mattress can significantly worsen existing aches and pains and even create new health issues by compromising posture, circulation, and sleep quality. A mattress that's over 7 to 10 years old often loses its structure, firmness, and ability to provide adequate support. Over time, the materials inside the mattress, whether coils, foam, or latex, begin to break down. This deterioration causes sagging, uneven surfaces, and pressure points that force the body into unnatural positions throughout the night. For older adults who may already be dealing with arthritis, osteoporosis, or spinal degeneration, such conditions can lead to intensified joint pain, sore muscles, and misalignment of the spine. One of the most critical issues with an unsupported mattress is poor spinal alignment. A good mattress should support the natural curve of the spine, keeping the head, neck, and hips aligned while distributing body weight evenly. When a mattress is too soft, the hips and shoulders can sink too deeply, placing strain on the lower back. Conversely, a mattress that is too firm can push pressure points like the knees, shoulders, and hips into painful misalignment. In either case, this improper support can contribute to restless sleep, morning stiffness, and chronic back problems. Additionally, old mattresses are more likely to accumulate allergens such as dust mites, mold, and bacteria, especially if not cleaned regularly. For seniors with respiratory conditions, this can lead to coughing, sneezing, nasal congestion, and even asthma flare-ups during the night. These disturbances further reduce the quality of sleep, affecting mood, memory, and energy levels. The next day, temperature regulation is another factor. Older mattresses often lose their breathability, trapping heat and moisture. For seniors who may already struggle with temperature sensitivity due to hormonal or metabolic changes, sleeping hot can lead to night sweats, dehydration, and interrupted sleep cycles. Modern mattresses, on the other hand, are often designed with cooling technology to help regulate body temperature throughout the night. Replacing an old mattress with one that provides the right balance of comfort and support can transform the quality of life for someone over 60. Memory foam, hybrid, and latex mattresses are popular choices for seniors because they offer pressure relief while supporting proper alignment. It's also important to consider adjustable beds, which allow older adults to elevate the head or legs, reducing snoring, acid reflux, and circulatory problems. Maintaining a consistent sleep schedule is one of the most crucial yet often overlooked factors in promoting health, especially after the age of 60. As the body ages, it becomes more sensitive to disruptions in routine, and sleep is no exception. Irregular sleep patterns can disturb the body's natural circadian rhythm, triggering a cascade of negative effects that impair heart function, cognitive performance, and overall well-being. The circadian rhythm is the body's internal biological clock that regulates the sleep-wake cycle over a 24-hour period. It is closely tied to environmental cues, especially light and darkness. When older adults go to bed and wake up at inconsistent times, staying up late one night, sleeping in the next, or frequently napping during the day, they confuse this rhythm. The result is a misalignment between the internal clock and external behavior, often leading to fragmented, poor-quality sleep. One of the major health risks associated with circadian rhythm disruption is cardiovascular strain. Research has shown that irregular sleep habits are linked to higher risks of hypertension, heart disease, and stroke, conditions that already become more prevalent with age. When the body does not get consistent restorative sleep, stress hormone levels like cortisol remain elevated, increasing inflammation and placing added pressure on the heart and blood vessels. Beyond heart health, an erratic sleep schedule can also impair cognitive function. The brain relies on regular sleep cycles to perform essential tasks such as memory consolidation, toxin removal, and mood regulation. Seniors who do not maintain a steady sleep routine often experience memo. As we grow older, our digestive systems naturally slow down, making it even more important to maintain habits that support efficient digestion. One of the most harmful habits for people over 60 is lying down or going to sleep immediately after eating. While it might seem convenient or comforting to rest after a meal, especially in the evening, this behavior can trigger a host of digestive problems, the most concerning of which is acid reflux, also known as gastroesophageal reflux disease, GERD. When you lie down after eating, gravity no longer helps keep food and stomach acid where they belong in the stomach. Instead, lying flat can cause the contents of the stomach to move upward into the esophagus. This backflow leads to the unpleasant burning sensation of heartburn and, over time, can damage the esophageal lining. Seniors are particularly at risk because the lower esophageal sphincter, the muscle that keeps stomach contents from rising, often weakens with age. GERD is not just uncomfortable, it can become dangerous. Chronic acid reflux has been linked to more serious health problems, including esophageal inflammation, ulcers, and even Barrett's esophagus, a condition that increases the risk of esophageal cancer. In older adults, untreated acid reflux may also affect sleep quality, cause chest discomfort, sore throats, or chronic cough, all of which diminish overall quality of life. In addition to reflux, sleeping soon after a meal can hinder proper digestion. The body digests food most efficiently when it is upright, as this position encourages the movement of food through the gastrointestinal tract. Lying down too soon can slow digestion, leading to bloating, gas, indigestion, and a feeling of heaviness. These issues are not only uncomfortable, but can also lead to poor nutrient absorption over time, which is a concern for seniors, who may already face challenges in meeting their dietary needs. Another overlooked danger of post-meal sleep is its impact on blood sugar. After eating, especially meals high in carbohydrates or sugars, the body experiences a rise in blood glucose levels. If you immediately go to bed, your body burns fewer calories, and blood sugar may remain elevated for longer. This can be especially harmful to older adults with prediabetes or type 2 diabetes, increasing the risk of complications like insulin resistance, fatigue, or weight gain. To reduce these risks, it's recommended that seniors wait at least 2-3 hours after eating before going to bed. This allows enough time for digestion to progress and reduces the likelihood of reflux. If a nap is necessary during the day, it's best to keep it short and elevate the head slightly to aid digestion. For nighttime meals, opting for lighter, less fatty foods can also make a significant difference. As people age, sleep-related breathing disorders become more common, and among them, sleep apnea is one of the most serious. For individuals over 60, sleeping flat on the back without any head or upper body elevation can significantly worsen this condition, often without their awareness. While BOF sleeping is generally considered good for spinal alignment, it becomes problematic when it restricts the airway. Seniors must understand the risks and adjust their sleep posture accordingly to safeguard their health. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often due to the collapse of soft tissues in the throat. Obstructive sleep apnea (OSA), the most common form, is especially dangerous when lying flat on the back. In this position, gravity causes the tongue and soft palate to fall backward toward the throat, narrowing or completely blocking the airway. This makes it more difficult for air to pass through and can result in episodes of breathlessness, loud snoring, choking sensations, or gasping during the night. For seniors, this breathing disruption leads to a decrease in oxygen supply to the brain and other vital organs. As a result, the body is repeatedly jolted awake to resume breathing, often without the person fully realizing it. This constant cycle fragments sleep, reducing its restorative value and leading to chronic fatigue, memory problems, irritability, and impaired cognitive function. In the long term, untreated sleep apnea significantly raises the risk of high blood pressure, stroke, heart disease, and even sudden cardiac arrest. Even for those without a formal sleep apnea diagnosis, back sleeping without elevation can still cause breathing difficulties. Age-related changes, such as loss of muscle tone in the throat and increased fat deposits around the neck, make it harder to maintain an open airway during sleep. This means that even mild airway restrictions can cause poor sleep quality and nighttime oxygen drops, which are especially dangerous for people with pre-existing heart or lung conditions. Fortunately, One of the simplest and most effective interventions is to elevate the upper body while sleeping. Raising the head of the bed by 30 to 45 degrees, or using a wedge pillow can prevent airway collapse by keeping the throat muscles in a more open position. This elevation also helps reduce snoring, minimizes acid reflux, and encourages smoother, uninterrupted breathing throughout the night. For seniors who use adjustable beds, this feature can be especially helpful in maintaining a healthy and safe sleeping posture. In some cases, side sleeping, especially on the left side, can also help prevent airway blockage and reduce apnea episodes. Using body pillows or specialized sleep aids can help seniors stay in this position comfortably throughout the night. The environment we sleep in plays a significant role in the quality and safety of our rest, especially as we age. For those over 60, sleeping in a cold or poorly ventilated room can silently affect two vital systems: circulation and respiration. While some people assume cooler temperatures always promote better sleep, excessive cold or a lack of airflow can have adverse effects on the aging body, leading to stiffness, breathing problems, poor oxygenation, and even increased risk of illness. As we grow older, the body becomes less efficient at regulating temperature. Seniors typically have slower metabolism, thinner skin, and reduced fat insulation, which makes them more sensitive to cold environments. When a room is too cold during sleep, blood vessels constrict to conserve body heat. This vasoconstriction reduces blood flow to the extremities, which can aggravate conditions like arthritis, muscle cramps, or Raynaud's disease, common issues among older adults. Cold-induced stiffness may lead to morning pain or reduced mobility, increasing the risk of falls or joint injuries. In extreme cases, seniors sleeping in cold environments may also experience hypothermia during the night, especially if they're underdressed or use inadequate bedding. Nighttime hypothermia doesn't always present with shivering but can manifest as confusion, slow breathing, or a dangerously low heart rate, symptoms that may go unnoticed until serious harm occurs. Poor ventilation is another hidden danger. A room that's closed off, lacks fresh air circulation, or has stale, recycled air can reduce oxygen levels, leading to shallow or irregular breathing during sleep. Seniors, especially those with asthma, COPD, or heart conditions, need good airflow to maintain adequate oxygenation throughout the night. Breathing in carbon dioxide-rich or allergen-filled air can result in frequent awakenings, morning headaches, fatigue, or even cardiovascular stress over time. Additionally, poorly ventilated rooms tend to accumulate allergens such as dust mites, mold, and pet dander triggers that can cause nasal congestion, sinus irritation, or asthma attacks. These issues are more problematic at night when lying flat and can severely disrupt sleep quality, especially for older individuals who already have weakened respiratory systems. To mitigate these risks, seniors should aim to sleep in a room that is moderately cool, around P-70 degrees Fahrenheit or P-21 degrees Celsius, well ventilated and free of allergens. Using layered bedding allows for better temperature control without relying on excessively cold air. Installing a HEPA filter, using a fan or slightly opened window, and avoiding overcrowded or stuffy sleeping areas can help ensure a continuous supply of fresh, clean air. As we age, maintaining brain health becomes increasingly important, while diet, exercise, and mental stimulation are well-known factors in preserving cognitive function. One of the most overlooked contributors is sleep consistency. For individuals over 60, having erratic bedtime habits, going to sleep and waking up at different times each day, can gradually impair memory, concentration, and emotional stability. In the long term, this inconsistency may even increase the risk of developing cognitive decline, dementia, or Alzheimer's disease. The brain relies on routine to function optimally. A consistent sleep schedule helps regulate the body's circadian rhythm, a natural internal clock that manages the sleep-wake cycle over a 24-hour period. When you maintain regular sleeping and waking times, your brain becomes conditioned to follow predictable patterns. This allows it to enter deeper, more restorative stages of sleep, which are critical for memory consolidation, toxin removal, and neural repair. However, inconsistent sleep disrupts this rhythm. If you go to bed late one night and early the next, or frequently nap during the day without a set routine, the brain struggles to enter and maintain the deeper stages of sleep like REM, rapid eye movement, and deep non-REM sleep. These are the phases where short-term memories are converted into long-term knowledge. Emotional experiences are processed, and brain cells regenerate. Without regular access to these sleep stages, older adults may begin to notice issues such as forgetfulness, slower reaction times, and difficulty focusing. Sc.